we're going to talk about a diabetes drug causing cancer and how Big Pharma was fined for destroying the evidence. Okay, that's not the first time this has happened. Why is it, however, that serial criminal behavior within the pharmaceutical industry and the banking industry and the insurance industry and the energy industry and the defense industry and the intelligence industry is considered normal, acceptable, pay a fine, everything's fine, and go forward? You and I, we jaywalk, we can be arrested. And it stays as a stain forever. I'll deal with that. Chronic stress of cancer causes accelerated telomere shortening. That's not good. What does it mean? I'll tell you about how to deal with cancer so you're not shortening your life otherwise. Also, if you do not have enough vitamin D, you could end up with an increase in hepatitis B viral replication. But if you do have enough, you can stay in a dormant stage and hence not risk your life. Also, vitamin D, according to Leona University, can help prevent and treat diseases associated with aging. We'll give you the latest on that. Also today, we'll take a look at salt and what salt does to increase your risk of stomach cancer and more on health and healing. In our health and nutrition segment today, I want to focus upon a drug. This is a diabetic drug that has now been shown to cause cancer. According to Natural Health, back in 1999, the Food and Drug Administration approved a new drug called Actos, A-C-T-O-S, for the treatment of diabetes in the United States. It did not take long before the drug became the best-selling diabetes treatment in the world, primarily due to its effect of reducing glucose production in the liver. For those taking the prescription, Actos seemed like a godsend. However, its manufacturers were hiding a dirty little secret. Within just a few years, the U.S. patent was in full bloom, the profits were pouring in, but the patients taking Actos began to develop serious conditions in connection with this drug. Some experienced heart problems, whereas others were developing bladder cancer at faster rates than individuals who did not take Actos. However, the sales of Actos continued, peaking in 2011. Several researchers have studied the side effects of Actos, including epidemiologists at Lady Davis Institute of Jewish General Health in Montreal, Canada. After reviewing the medical records of more than 115,000 people who took drugs for diabetes between 1988 and 2009, they discovered that people who took Actos were 83% more likely to develop bladder cancer than those who did not. Between 2011 and 2013, several countries banned or heavily restricted the use of Actos, including France, Germany, and India. The FDA was forced to acknowledge Actos' side effects in 2011 when it released a statement and warning about increased risks of bladder cancer among people taking Actos for more than a year. Yet they had merely slapped a warning label on the drug and allowed sales to continue despite known Actos side effects. Multiple lawsuits and a giant Big Pharma cover-up that could have cost the lives of many. Takeda, the Japanese-based company that produced Actos, was aware of potential health risks linked to the drug long before the public became aware of its dangers. In fact, the manufacturer conspired to keep the medicine's risks a secret before it went on sale in the United States. Internal emails going back to 2005 between Takeda management officials acknowledged the potential risks of bladder cancer in people taking Actos. In those emails, the big shots at Takeda emphasized the importance of standing behind the drug instead of standing up for consumers. Thousands of lawsuits have been filed against the company, with the company ordered to pay tens of millions of dollars in punitive damages to victims. But the most ghastly discovery came in late 2014 when a jury found Takeda guilty of destroying evidence that proved its drugs caused bladder cancer in some individuals. The sick and twisted game that this company has been playing unfortunately continues today. Takeda continues to stand behind its product, and the U.S. continues to allow its sale to Americans, as the government continues to undermine U.S. citizens and look the other way when greedy drug manufacturers take advantage of unsuspecting patients. The pharmaceutical industry and the government-run health agencies cannot be trusted. Google the war on health, and then a little later on, you can call in and tell me what you see. Now, Google rates a film, for example, based upon the words used and its placing. It might have 10 million placing. You might be dead last. Therefore, maybe 30 people have seen it. But when you're placed first on the page and second on the page and third on the page of all those listings, it means you're getting a predominant amount of the attention on that search engine. So Google the war on health. That was my film that took on the FDA and the U.S. Public Health Service, the overarching umbrella organization that controls all health care, the National Institute of Health, the National Cancer Institute, National Institutes of Allergy and Infectious Disease, the CDC, and the FDA. It is utterly corrupt. It is totally controlled by Big Pharma. But you cannot make an attack. It will just seem like some ad hominem screed. Instead, you must methodically take point for point, drug for drug, lobbying efforts, and then drugs get in that are dangerous. People at the FDA and USDA and CDC going from being in a top position into the very pharmaceutical industry they were supposed to be protecting us from. Watch the film. Share it with others. It's time people saw what they were dealing with. I'm Gary Null. Chronic stress of cancer causes accelerated telomere shortening. Now, we know that telomeres are the protective ends of chromosomes. And what you want is for them to stay longer. You do not want them to shorten. If they shorten, that cell is going to die faster. When you smoke, when you drink, when you're under stress, when your body's polluted, when you're overweight, you shorten them very rapidly. That's why an entire generation, in fact, 2 entire generations, the generation born in the 1920s and 30s died earlier than what they should have, with some rare exceptions. You were lucky to make it about 65, 66 years of age because they smoked and they drank and they ate a very limited diet, mainly meat-based and lots of dairy, and they didn't exercise, so they were shortening their telomeres. By going vegan in a healthy way, by exercising, dealing with stress, turning off inflammatory agents, taking your antioxidants, drinking your juices, you are indeed then lengthening your telomeres. From the latest study, a recent study presented at the AACR annual meeting, talked about the idea that improving the quality of life affects stress-related biological markers and possibly the health of people with cancer. And here's what it had to say. Quote, researchers know that telomeres shorten and deteriorate with aging, but they are learning that stress also affects telomere length. We're trying to understand the interconnections between the mind and the body, that is, how does the diagnosis and treatment of cancer impact patients not only physiologically, but also psychologically, and how can we improve their outcomes? Cancer drives a chronic stress response in some patients. And that was from a professor, MD, Chief of Hematology Oncology, University of California, Irvine. Well, just as the aglets prevent a shoelace from unraveling or fraying, telomeres are structures on the ends of chromosomes that protect the chromosome from deteriorating and breaking apart or joining with other chromosomes, which can lead to mutations. So chromosomal rearrangements are seen in cancer and provide a biological reason to investigate this link. Quote, for this study, we wanted to know if chronic stress, which, by the way, I would say almost everyone diagnosed with heart disease or cancer has, was associated with accelerated telomere shortening in cancer patients, and if a psychological intervention that modulates the stress response could also modulate telomere length. End quote. Now, in this retrospective study, the researchers took biological samples from the women with cervical cancer who had been randomized into a couple groups, and what they found was that giving them stress management, handling them at an emotional level, helping them to enhance health and wellness, and sexual concerns and all the other things that occur in a person's life, quote, improved quality of life and reduced stress response associated with changes in telomere length, end quote. So, what is the takeaway message? It doesn't matter what disease you have, Alzheimer's, Parkinson's, cancer, diabetes, heart disease, there is stress. The stress shortens the telomeres then cannot protect the chromosomes, and the cells die or become mutated. By de-stressing, you lengthen the telomeres. Exercising does the same. And by having a really good support system at the emotional level, you're able to not end up shortening your life because of your stress. One more reason to take time to de-stress. And finally, reduced levels of vitamin D increase your hepatitis B viral replication. This is the newest research on here. Quote, vitamin D helps maintain a healthy immune system, and there is evidence of its role in inflammatory and metabolic liver disease, including infection of hepatitis C virus. This was from a leading virologist at the Johann Wolfgang University Hospital in Frankfurt. So what they found was that if you have low vitamin D, you're more likely to have a manifestation of increased viral activity. Hence, take more vitamin D to prevent that from happening. And while you're at it, Loyola University just found that having vitamin D at good levels helps prevent and treat diseases associated with aging. So that's good news. And also, with the more salt, the more risk of stomach cancer. So get rid of the salt in the diet. Use lemon juice. Use a combination of lemon and apple cider vinegar. Gives you a salty taste, but it's all good.